Okay. My surroundings. Here I got my MAR and my provider's orders. And my supplies. There's the sink and everything. And my Joe arm. So first I'm going to go over here and wash my hands. Hi, my name is Danielle. I'm going to be your student nurse today. Can I get your first and last name? Joe Smith. And Joe, do you have any allergies? Sulfa and betadine. So looking at provider's orders, it looks like we are going to, I'm going to be starting your saline drip with your antibiotic. Is that okay? I'm checking his wristband with provider's orders. And I'm just going to move my camera over this way. So I'm going to compare my MAR with my provider's orders. So I have my cefazolin. For Joe Smith, I have 1 gram of cefazolin given every 8 hours for pneumonia by IV. I have my normal saline for Joe Smith, 3 milliliters IV push given every 12 hours or PRN for patency. I have my normal saline drip. I have my 1,000 milliliter normal saline drip that's given over 10 hours, so that is 100 milliliters per hour. That's given for fluid balance. I am making sure to provide privacy. I am going to open my packaging on the perforated edge. I'm going to check my items for expiration date. Okay, back up. Before I open, I'm going to check my packaging for the integrity of my packaging and my expiration date. My saline expires 10/27, and then my primary tubing expires 8/9/25. My integrity is okay. My saline push is not expired, and integrity is intact. And then I have my secondary tubing, which is not expired, and the packaging is intact. My cephalosporin, that is not expired, and the integrity is intact. I'm going to open up my packaging on the perforated edge. So it is all good. I have labeled my tubings and both of my drainage bags. So my cephalosporin and my saline is compatible. I will be monitoring for an allergic reaction, INR, input and output, vital signs, and any signs of fluid retention. I'm going to do my first check with my MAR. So my patient, Joe Smith, I have my 1,000 milliliter of normal saline that is given over 10 hours, so that is 100 milliliters per hour. I have my 3 milliliters of normal saline. My 1,000 milliliters of normal saline is given for fluid balance. I have my 3 milliliters of normal saline flush. That is given every 8 hours for patency. I have my 1 gram of cefazolin injection that is diluted in 50 milliliters of saline, and my drip rate for my cefazolin is 38 drops per minute, and my drip rate for my normal saline is 25 drops per minute. These are compatible, and I already said that I will be monitoring for INR, allergic reactions, INO, vital signs, and fluid retention. I'm going to put my gloves on and do my second check. I have my patient, Joe Smith. My medications are 1,000 milliliters of normal saline, my 3 milliliters of normal saline IV push, and my 1 gram of cefazolin that is diluted in 50 milliliters of normal saline. My drip rate for my normal saline is 1,000 milliliter over 10 hours, which is 100 milliliters over 1 hour, and my drip rate is 25 drops per minute, and my math is correct. I have my 3 milliliters, my normal saline is given for fluid retention, my 3 milliliters IV push of normal saline is given for patency, and my cefazolin that is given for pneumonia, is diluted in 50 milliliters of normal saline, and my drip rate is 38 drops per minute, and and these will be given through his IV in his arm. I have placed a clean barrier, and I'm going to do my third check. I have my patient, Joe Smith. My medications are 1,000 milliliters of normal saline, 3 milliliters of IV normal saline IV push, and my 1 gram of cefazolin that is diluted in 50 milliliters of normal saline. It is the right time, as it has not been given yet. I forgot to say in my first and second one that it is the right time, but I am verbalizing that now. It has not given within the last 8 hours, so it is due, which is why I'm administering it now. His INR is 2, which is within the normal limits, and he has no history of allergic reactions to cephalosporins or penicillin, so I will be administering this medication. My saline is given for fluid balance. My 3 milliliters of IV push is given for patency, and my cephalosporin is given for his pneumonia. I am going to scan his wristband and my medications, and I have the right patient, Joe Smith, medications, time, route, IV, and it is due, and I've scanned my medications. So Joe, the cephalosporin inhibits the cell wall synthesis in bacteria, which kills the bacterial cells, clearing your infection, and your saline maintains your fluid balance and your output and filtration with your kidneys. These medications are compatible. Some side effects are nausea, vomiting, and you should report any signs of bleeding, bruising, diarrhea, or allergic reactions. I will be monitoring your INR, any signs of allergic reactions or fluid retention. Is this okay? Yes. I am verbalizing that he understands, and if this was a high potency medication, I would check it with my nurse. So my packaging has been opened. I'm going to prepare my primary IV. I'm taking my cap off, making sure it stays sterile, and I'm going to take off my cap to my other thing, and I'm making sure my roller clamp is clamped, and I'm going to hang it up over here.
So you need to go in, what is the intake and what is the output?
Okay, and I'm just holding this there. Making sure that stays. I'm going to open it holding it above and I'm flicking it so that any air bubbles were to get out any air bubbles. Okay, and now I'm closing my roller clamp, and this, I'm making sure that's clamped. I'm going to take my cap off, I'm going to pull back and then push so that the air comes out. Putting my cap back on, making sure that it stays sterile. I'm going to grab my alcohol wipe and I'm going to clean this for 30 seconds. 1, 2, 3, 4, 5. His IV site is labeled with the date, initials, and size. I will not be changing it because hospital policy, it has to be changed every 96 hours, and since it was placed yesterday, I will not be changing it. There's no signs of bleeding, infection, phlebitis, which is inflammation of the veins. I would see bruising, I would see pooling of fluid around or underneath his arm. And there's no pain at the site. I'm going to maintain sterility. I'm going to adjust that. I'm unclamping my clamp. I'm pulling back just a little bit to see blood return. And I am pushing my 3 milliliters of fluid. Okay, and I'm going to take this off. I would clamp first, take it off, and put the cap back on my ceiling brush. I'm going to cleanse again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, making sure it stays sterile. I'm going to secure my IV, and I'm going to make sure that it drips. Oh, I have to clamp my tubing. There we go. Now it's going. Okay, so I have some air in my tubing, so I'm just gonna clamp. For the sake of this video, I'm gonna just get the air out so that it drains properly. I would make sure I cleanse or get a new tubing, but I don't want to run out of time. And this is like my 5th time doing it. Okay, I got that air bubble out. I would, like I said, I would re-clean this, but I don't want to run out of time. Okay, I'm going to set my drip factor for 25 drips per minute, which is about 6 drops per minute, or per 15 seconds. Okay, and I'm gonna bring my camera close so you can see. Okay, and I'm just putting this back, and I'm going to set up my secondary tubing, so I'm going to take off my end and this and insert it like so, put it upside down and squeeze the chamber some so that it is primed. I'm going to close my roller clamp and open up my ABD. I'm going to prime my tubing for 30 seconds. Taking this cap off and doing that. I'm going to lower this and undo my clamp so that the air comes out, and it has, except I got a little bit too much, there we go, okay. And I'm now going to lower my primary, below, open this, go to my secondary, and regulate my fluids with my secondary clamp, with my primary clamp. Why isn't this working? Okay, now that's filling. This is open.
Today, Joe, we're going to be inserting a catheter, and when you answer a few questions.
I don't know why this isn't working. Oh, I think it's not high enough.
That you have your output.
I don't know why this isn't working.
Do you feel any pain?
Oh, I see it now. It's working. So I want to regulate to 38 drops per minute,
Patient is
which is about 9 drops per 15 seconds. I have my drip right set, and just so you can see that. Okay. All right. Joe, do you have any questions? I am going to monitor Joe I'm going to monitor his INR for an allergic reaction or a fever. I will document my findings, and my bed is lowered, locked, call light within reach. I have my lines and my bags are labeled. And that's it. Thank you, Joe. I'm going to clean up and document my findings. Joe doesn't need anything. He has his call light and he is safe.